Assessments. Who should get one and what to expect. Assessments for adults who need help. Assessments for adults are for people over 18 years old who need help because they are ill, disabled, old, or have a mental health condition. If the adult you care for hasn't been offered an assessment, you should ask for one. You can ask your local council for an assessment by phone, in writing, or online. But first, you must ask the person you care for if they want an assessment. If they cannot speak for themselves, you can ask for an assessment on their behalf, which means you can ask for them. If you are caring for someone, the person you care for does not have to have an assessment for you to have one. And they can still have an assessment even if you're already looking after them. Your assessment is separate from theirs. You and the person you care for can choose to have an assessment together. It will depend on the council if they can assess you and the adult at the same time. How to get ready for an assessment. Before an assessment, you and the adult you care for should think about some important things. Things like their needs, the needs of their family and children, their well-being, the things they want to do, the people they want to spend time with, and the place they live, and if it suits their needs. The adult you care for might need help during the assessment. You or someone else can be there if they want. If there is no one to help, the council must provide someone. After the assessment, the adult you care for may or may not get extra support. The council should still give advice about their needs. How to get care and support elsewhere. How to get help with money. How to stop problems getting worse. How to get help for you as their carer. As their carer, you must tell the council what help and support you are happy to give and what support you are not happy about doing. Then, the council can check if all the adult's needs are met. The council doesn't have to help the adult if all their needs are met already. The council might support the adult by doing things like providing services or money for services, making changes to a disabled person's home like installing grab rails, providing extra care for them so that you can have a break, provide things like meals, transport and laundry. They might offer free services, or they might have to charge. They will first check how much the adult can afford to pay. If the person's health gets worse, you can ask for a new assessment. This can happen any time the person's health gets worse. Assessments for children who need help. Some children might need extra support from the council. For example, if they are disabled. If you think a child needs an assessment, you should ask for one. You can ask the council for an assessment by phone, in writing, or online. When assessing children, councils must think about what support the child wants, what support the child needs, what support the parents need, the child's well-being, the needs of other children in the home. Councils might do a child, adult and carer assessment at the same time. How to get ready for an assessment. Make a file of all the information you have about the child. For example, collect all medical information and letters from the doctor. You may want to ask the child's school for information they have on them. If you think it would help, have someone else with you at the assessment. Think about what you may want to say. Things like how caring affects you and your family, the child's needs, what support you need, what may happen if you don't get help. Make notes during the assessment if you think it will help. A child may get extra help for things like help at home, after school club, help with transport, help making changes to their homes like ramps or rails, help with the cost of things like holidays or extra support so that you can take a break. The council might offer other services to help you and the family. The council cannot charge for any support they give to a child. When a child becomes an adult, they will need a new assessment. If the child's health gets worse, you can ask for a new assessment. This can happen any time the child's health gets worse. Assessments for young carers who need help. Young carers are children under 18 who care for someone. Young carers might care for a parent who needs support. An assessment will find out what help the young carer needs. It is important to protect the young carer's well-being and to make sure they are not missing out on important things like education. Councils can insist on an assessment if they think a young carer's well-being is at risk. You can prepare for an assessment as a young carer in the same way as an adult carer would. Assessments for parent carers who need help. A parent carer is someone over 18 who cares for a disabled child. Councils should assess parent carers as soon as they know they need help, or when parent carers ask for help. Councils can assess the parent carer and the disabled child at the same time. When assessing, the council should think about important things like if the parent carer needs support, if the parent carer can provide the support the child needs, the well-being of the parent carer, the welfare of the child and that of any other children being cared for. For information about how assessments are done, click on the on-screen link to the next video in this series. If you found this clip useful, please like and subscribe to our YouTube channel.